Hey guys, welcome to my next installment of our little pain chats. If you didn't tune into Pain Science 101, I would recommend doing so before you watch this video, just so you have a little bit of background knowledge about what we're going to be talking today. But if you didn't, my name is Jess. As of this moment, I'm a third-year DPT student, and this is acute versus persistent pain. How does it change? So after Pain Science 101, you may be thinking, okay, that fire alarm thing is great and all, but my back has been hurting for years. How does that work? Or what's going on in my back that's making my brain want me to change something so badly that has created this horrible pain for so long? And just as there are many types of pain, there are many reasons this persistent pain can be happening. Also, note how I said persistent pain, not chronic. Chronic pain implies that it's something you'll be managing forever, which is just not the case. It's persistent, like a stubborn wine stain. It's going to take a bit to fade because it's been around for a while and maybe wasn't hit right away with some OxyClean, but it's not chronic. The shirt isn't ruined. It will get better and the stain will go away. So let's dive in, shall we? When we think of persistent pain, many people think it's due to repeated injury and repeated tissue damage. So while this is something that happens, it usually clears up in a few months. If you're still experiencing pain after 4, 5, 6 months, or even years, that tissue is healed. So that's no longer the driver of that danger signal that your brain sends in the form of pain. Something's been altered in the nervous system, whether it's the spinal cord, the brain, or the sensory system. So this is where things get complicated. I'm going to break this up into 2 videos because if I went through the whole thing in one, it would be quite lengthy, and I want to give you guys some time to simmer on the information that I'm about to give you. So let's start with the sensory system, your peripheral nervous system, and work our way up. So when there is tissue damage, a bunch of healing chemicals flood the area, causing inflammation and swelling. So let's call this fluid healing juice. This healing juice creates a chemical environment that changes the property of the nociceptor nerve ending to make it more excitable, meaning it needs less input to send a danger message up the spinal cord to the brain. We call this sensitization because it is more sensitive to input in order to protect the damaged tissue from further damage while it's healing. In typical circumstances, when the healing juice goes away, once it's done its job, the sensitization fades as well, and the nerve ending's excitability goes back to normal. Now, with persistent pain, that nerve doesn't go back to its original state once the juice is gone and stays sensitized. So with this peripheral sensitization, as we call it, even though there's no tissue damage present and no need to protect the area, those nociceptive nerve endings are still sending those danger messages up the spinal cord in response to lower input than usual. So when this is occurring, something like clothing against the skin may cause pain. Even though the clothing poses no threat, those nociceptors are hypersensitive. So what would usually tell the brain, yes, this is a nice, cozy, fuzzy sock, this is great, now tells the brain, alert, someone's rubbing sandpaper on your foot, get it off. So that's peripheral sensitization. For whatever reason, those nociceptive nerve endings stay on hyper alert, even though there's no need for it. So that's your peripheral nervous system. Tune in to the next installment for your central nervous system. Give yourself a little time to sit with that information, let it sink in, take a little mental break, and we'll be back.